When people have chronic pain and chronic irritation conditions, every time you show up at a doctor or a clinician, it's like, what's your pain level? How long have you been in pain? How chronic is your pain? And you're always thinking about and monitoring your own pain. And to me, that's not the best way from a pain science perspective to calm the brain into thinking about being in less pain.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome to episode number 40 of the Healthy Skin Show. On today's show, we're going to talk again about a condition called lichen sclerosus. We talked a while ago about this with Dr. Anna Cabeca, but that was from an OBGYN perspective. And today's guest is going to talk about how to address it from a physical therapist perspective, as well as adding in some dietary and lifestyle tweaks that can also help. Before we get into this conversation today, I want to share a review that one of our listeners left over on iTunes, partially because something they said in the review, which was, I will admit, slightly critical of our previous show. And I felt that it was worthwhile to address it because they were right. Rena1234 shared, I liked that someone actually discussed this, which is specific to lichen sclerosus, because I feel like it's a subject a lot of women are embarrassed about, and they really shouldn't be because it just kind of happens. It's not like they catch it sexually, or for those who aren't educated about it, they assume the worst and think it's an STD. A lot of women are afraid to share this with their doctor, their partner, anyone. And really, we should talk about it more because I think it would benefit so many people. But one thing I didn't disagree about with the episode is where she says this is specifically for women. And no, you're wrong. Men can have this too. I want to thank you, Rena, for pointing this out because you are right. Lichen sclerosus can affect men. That is absolutely true. And there are men who listen to this show. There are also women who have husbands that may have this condition. But I specifically mention women here because most of our listeners are women. Dr. Anna Cabeca is an OBGYN. So she specifically treats women, which is why we said that the show was for women, because it was coming from the woman's perspective of having lichen sclerosus. And to be fair, most of my clients are also women. So it wasn't an attempt in any way, shape, or form to say that men don't get this condition. If anything, we were just honoring space to have the discussion for women in that particular episode. And the same would be the case with today's episode, since we're specifically looking at this from a woman's perspective. That said, based on your feedback, it is worthwhile to share that this is a condition that can affect men, and hopefully we can find somebody that will come on the show and talk about how to address it from a male perspective with some alternative information. That's the one piece to this that we struggle with oftentimes, is finding doctors and experts that are experts in a specific condition, but look at it from a different perspective. Thank you so much for bringing this up. I love good feedback, especially when it's something that allows us to expand the information that we're sharing. And it now is an opportunity for the Healthy Skin Show and myself to share with listeners that if you've got a man in your life who is experiencing symptoms down below and they're really embarrassed or uncomfortable, they're afraid to tell their doctor, this is something that you should talk about. And hopefully we can find someone to come on the show that will have a frank discussion about what you can do. I would suspect that there may be some overlap in the way that this condition is addressed both in women and in men. However, I say that from having no experience working with men with this condition. It's my hope that we can provide a more balanced conversation on this topic and give men the time and the space that they also deserve, because their suffering is just as equal as women's suffering and going through these conditions that, unfortunately, because of where they affect the body, can feel incredibly embarrassing. So please stay tuned, and I promise that I'm going to work on finding somebody who can come and speak about this from a very intelligent perspective. Shifting gears a little bit, I received a message from a listener that really touched me and in a sense almost broke my heart a little bit because of what she shared. And I felt that it was imperative that I get an answer to her as soon as possible. Let's take a listen.
I have had a skin rash and it is driving me insane. I have been to dermatologists and doctors and it comes and goes. I've been on gluten-free and then I stopped. And I'm going to another dermatologist on Thursday. I need help. And the dermatologists have tried steroids. They've tried medicines for my rash. I don't know if it's from medication. I kind of at my wit's end. I would like to hear from you and get some help. I don't want to commit suicide over it, but it is enough to drive you nuts. Thank you for your time. I appreciate it.
Ina, I want to thank you so much for sharing this. I know that it's not easy, but when you're in a place of feeling pretty desperate, especially when all of the experts or your doctors whom you've seen aren't really of much help, it's pretty commonplace to begin looking outside of the traditional way of addressing skin rash issues, especially when you have some sort of mystery situation that comes and goes and doctors really don't know what's going on. The first thing that I would say is that you should ask them for a biopsy or at least a skin scraping or both. That way they can get a sense of what exactly is going on. When that rash erupts, that's the time to call the doctors and get into their office ASAP. My next thought is that there can be underlying things that could trigger a rash to come and go. And oftentimes there are things that are deeper or below the surface that your dermatologist isn't necessarily going to ask about nor look for. Those things include certain gut infections, like specifically parasites, because parasitic infections can be experienced as symptoms that sort of come and go, and you can't really put any rhyme or reason to them as to what exactly is going on. A parasitic infection most likely will show up with some sort of extensive stool testing, which is what I do in my clinical practice with clients, especially when they've had really strange symptoms that we can't pinpoint. The next reason could be hormones, because as women, our hormones change throughout the month. As the hormones rise and fall, for example, you may experience symptoms that also correlate with those surges and declines in very specific hormones. So that might be another avenue to explore. Another thing that people oftentimes discount are changes in environmental exposures. And what I mean by this is, for example, if maybe your condition improves tremendously when you leave your house and you go stay at someone else's home, and then you come home and the issue reemerges. That is usually a red flag for something like mold toxicity or mold exposure in your home. However, we're also going through a period right now of seasonal changes depending on where everyone lives. And so if your condition is exacerbated by an increased exposure to the various pollens and such that are outside, that could certainly be a trigger, especially if your condition is more hive-like, itchy, swelling, and especially if it improves in using an antihistamine. That may indicate that those environmental exposures are actually causing an issue, and potentially seeing an allergist and figuring out what those triggers are can be helpful, but it also means that we've got to figure out how to reduce your level of reactivity to everything. And I know you said that you were gluten-free. Gluten-free isn't enough to really resolve the issue on its own. However, regardless of what is going on, if there is a gut component, removing gluten is a really critical step. And so while it will not entirely correct the issue, and you might not actually even see nor feel an improvement, it is at least one helpful step in reducing the gut's permeability level, right? We want to have an intact barrier in the gut, just as we do on our skin, right? We want those barriers to be intact. And when we consume gluten, that creates a leakiness through the gut barrier. And so that's why going gluten-free and really sticking to gluten-free is going to be an important part of the process. The other piece is stress levels. Obviously, stress can impact our body in very interesting and sometimes highly annoying ways. It's not to say that using the reason of stress as a factor here is to blow off why you're experiencing certain things, but it's worthwhile to acknowledge the tremendous challenge that high loads of stress or the inability to manage the stress that you experience, as well as traumas, both little and small throughout your day, week, and month, put on your system. I have found in my clinical practice that stress management can also play an important role in helping to reduce flares and the cortisol responses that happen as a result of those flares that also help precipitate and drive the reactions that we experience, because they are highly stressful, which in and of themselves causes more stress, which then causes us to feel as if we're running from a tiger. But that tiger happens to be our skin, and it's incredibly uncomfortable. It can keep you up at night. It can drive you nuts. And there is a lot of research showing how desperate that can make people with eczema, psoriasis, and all these other skin conditions, even if they're mysterious, feel. And I don't want you to feel alone in this. You certainly are not. Many of us have been there. And so once you've seen your doctors, if you feel like you're really not getting anywhere and they're unwilling or uninterested, or maybe they just really don't know where else to look, it then becomes time for you to examine other ways to address these skin rash issues. There are other ways. You have other options. The dermatologist's office is absolutely not your final stop. You have other options out there, whether you start to seek out help from some sort of integrative or functional practitioner. There are other practitioners out there who look at these conditions like I do from a much different perspective. And it allows us to dive deeper into other systems of the body that also drive these particular conditions. And so that was one of the missions behind the Healthy Skin Show, was to say, hey, we all want to get back to healthy skin. It's not about beauty. It's not about aesthetics. It's really just about normalcy. We just want healthy skin. We just want to not have to worry about these rashes or the flares and the annoying itching and staying up all night and being driven crazy and feeling embarrassed. It's about finding the other options to help you get there. And that's what I want you to know, is that there are other options, and you at no point should feel as if you are entirely stuck in the mud because the dermatologist doesn't have any options for you. You have to be willing to look outside of it. And I appreciate you so much for being brave enough to submit this question, because I imagine that you are starting to think about what else could cause these issues. But that means that you've got to be willing to look in other parts of your body, your gut, your liver, your hormonal system, your thyroid. Do you have heavy metal toxicity? Are there traumas in your life that could be contributing to this? Stress levels, autoinflammation, autoimmunity, etc. There are so many other things to look at. You just have to be willing to go there. So that is the question. Feel free to drop us a line and submit any other questions that you may have, or contact us and let us know how we can be of better support to you. And for any of you going through something where you feel really stuck, don't be shy. Submit one of your questions to our show that we can include in a future episode. I'm happy to answer it for you, or I'll find a guest who can answer that question for you and provide you with an alternative to what you feel like you're currently facing. The dead end that you may feel like you're in is only a dead end because you don't know what else is possible. And until you ask for help, until you're willing to step up and say, you know what? I'm not really sure if I've hit a wall, or I just don't know the way to get around this wall. And when you realize that, that's the moment where you can find more options and possibilities, because you're now looking at your situation and your problem, this skin problem, from a very different perspective. All you have to do if you want to submit a question is head on over to healthyskinshow.com, scroll down, and then you'll see our box of where you can actually leave us a voicemail to be included in an upcoming episode. With that said, let's dive into today's conversation with Dr. Jessica Drummond. Hi, everyone. Welcome back. I've got another dear friend of mine who's joining me today to talk about a topic. We have actually discussed this before, but we're coming at it from a different perspective this time. And give me a moment. We're going to dive into lichen sclerosus again, but I want to introduce my guest. Her name is Dr. Jessica Drummond, and she's the founder of the Integrative Women's Health Institute. And she's passionate about empowering women who struggle with chronic pelvic pain conditions and hormonal imbalances, as well as female athletes, and supporting women's health and wellness professionals globally. She has 2 decades of experience working with women using physical therapy and functional nutrition, and teaching her colleagues from an integrative, evidence-based, and conservative perspective. Thanks so much for joining us, Jessica.
Thanks so much for having me, Jen. It's my pleasure.
I am very excited to talk about this because you look at this from a different perspective. My clients that have had lichen sclerosus, it's like they struggle in silence, ashamed of this issue that they're dealing with. And it is, to some degree, very much a skin condition. And it's something that oftentimes they won't come to me as the outright issue. They'll be like, oh, and by the way, I have this thing. I don't know if you know what it is. So can you talk a little bit about what lichen sclerosus is and how it differs from some of these other conditions that, you know, from just a name standpoint, look kind of similar?
Right. So lichen sclerosus and lichen planus and lichen simplex chronicus, they sort of have different underlying issues, but all of them essentially present on the vulvar skin. And they also can be in the mouth, especially lichen planus can be in the mouth. And as you said, it's a skin condition that there's some mystery to it. Lichen simplex chronicus is really just an itchiness. It's a itchiness that can keep women up at night, but it's not an infection. It's just it's like an irritation, inflammation to the skin. Lichen planus and lichen sclerosus, from my perspective, the key factor is that they both have an underlying autoimmune component. And so the good news is that while conventional medicine is kind of limited to topical creams and steroids and things like that, which are necessary in some cases to use right away to make sure that the disease process doesn't progress. And, it's on the vulva. So it can actually sort of shrink the opening into the vaginal canal, which can be really painful and obviously make sex painful and using tampons painful and things like that. But from kind of the inside out, while that's going on to kind of initially limit the progression of the disease and treat the symptoms, we want to think of this from an autoimmune picture. And from a physical therapy standpoint, we want to consider that anytime you've got such intense irritation, whether it's itching or inflammation or pain in the vulva, in and around the vulva, your pelvic floor muscles are probably going to tighten up, right? So if you had like a lot of really irritated skin on your scalp or your neck or your throat, you'd probably kind of generally, even subconsciously, tighten up the muscles of your neck and shoulders, right? And it's kind of the same thing in a vulvovaginal perspective. If you know that every time you go to have sex or you put on tight jeans or you sit in a chair a certain way, or you're going to have to be sitting for a while, and that skin is going to be like feeling really uncomfortable and burning and itching, your whole pelvic floor musculature and surrounding area are going to be sort of tensing up in protection, right?
From a physical therapy perspective, is there a way to help with these conditions? Because obviously they're skin related and somebody's probably going, wait, physical therapy, how can that help? So tell us a little bit, because that's just kind of your specialty.
Yeah. So from a physical therapy perspective, what you can do, first of all, you need to find a physical therapist who has been trained and is an expert and has seen these conditions in pelvic physical therapy. And there's really 2 main things that physical therapy can help with when it comes to lichen sclerosus and lichen planus. One is just relaxation, mobility, flexibility of the pelvic floor musculature and surrounding fascia tissues. Because if, like I said, you're walking around with like a tight pelvic floor all the time, think about if your hand was stuck in this tight fist position all the time, would there be good blood flow for healing? No. There wouldn't be good nervous system conduction. You wouldn't have, you need flow and movement in muscles, tissue, fascia for good circulation, good lymph flow, things like that. And if we think about this as being potentially an autoimmune related condition, we can't bring the biochemical healing until we have biomechanical movement in the vagina, vulva, pelvic floor region, right? So that's one way that physical therapy can help quite a bit. Secondarily, as I said before, the skin itself can begin to really tighten up and tense up and close off the opening of the vaginal canal, and also maybe scar in and around the clitoris and internal, like labia minora, internal labia. And that can be painful for intercourse, clearly. So physical therapy can also help with recommendations for lubricants that don't have endocrine disruptors. We can use dilators, which are these kind of tube. Actually, I've got some right here. One second.
You're like, I have props.
Okay. So as I said, the skin around the vulvar openings, I have my little model here. And this whole opening area here to the vagina can basically close up from the irritation, inflammation, and the skin itself. So dilators are like small silicone. They have plastic ones. There's different kinds that you literally put in vaginally. Then practice relaxing the skin, tissue, musculature of the pelvic floor and external vulva so that, this is a pretty narrow one. It's about a little bit like double the size of one of my fingers, but they go up to, more human size as that tissue begins to stretch out. So we use vaginal dilators to stretch the tissue, but very gently. And you can stretch the tissue, move it, and get the vulvar tissues more comfortable with having something inserted like a speculum or a tampon, or ultimately during intercourse. So those are the ways that physical therapy can help. And then from a nutrition standpoint, we're really thinking of these conditions very similarly that we would with any other autoimmune condition.
And so let's talk about that, because you and I have both gone through this lovely process of learning a ton about nutrition and passing the CNS and everything. So talk to us a little bit about your experience from a nutritional perspective in helping clients with these issues.
Yeah, so from that standpoint, it really starts with the digestive function. So is your client, are you really chewing your food? Is there any problems with intestinal leaky gut, issues? Because that's directly related to triggering the immune system to be hyper responsive. Why is the immune system hyper responsive to these tissues? Well, something's going on. It could be related to what women are eating. And so we can do elimination diets. We can do strategies to heal the leaky gut, like adding zinc, adding glutamine, adding bone broth, anything that's going to both calm inflammation generally and heal the barrier between the digestive system and the immune system, which is the lining of the small intestines, from a nutrition standpoint can help heal lichen sclerosus, because we're really reversing autoimmunity at the very root.
And so for somebody that comes to you with these types of issues, is there a specific type of diet or any initial first steps that you might make recommendations on as far as just food or lifestyle?
Yeah, so stress is certainly a factor, because stress can increase the permeability. So that barrier between the digestive system, like your small intestines are where most of your nutrients are absorbed, and where the barrier is responsible, the lining of the intestines are responsible from keeping things from being exposed to your immune system that shouldn't, like bacteria. None of us are eating sterile food, right? We all live in environments where bacteria exist. So I actually the process I go through is starting with, is the digestive function working? Are you breaking down your food adequately? So that means, are you chewing enough? Is there enough acid in the stomach to really break down proteins? Or are you getting chunks of proteins that are too big, that are irritating the lining of the small intestine? Then to take the stress off the small intestine, we do a 4-week assessment of what's called the elimination diet, although I don't really like to think of it that way, because I don't want it to feel restrictive, because there's lots of delicious and healing foods you can eat. But it is helpful to eliminate, at the very least, dairy, gluten, sugar, soy, eggs, and sometimes a few other things, depending on what else is going on, just for those 3 to 4 weeks, but doing it really consistently for those 3 to 4 weeks so we can give the immune system time to calm down. But the more important thing is to make sure we're adding the nutrients that the immune system needs to heal and the digestive lining needs to heal. So zinc, glutamine, magnesium. My clients are slowly but surely, eating 8 to 10 servings of vegetables. We've got to get the anti-inflammatory nutrients in, and things like turmeric and ginger and rosemary and oregano, all these sort of calming culinary herbs and spices, and things that calm the lining of the digestive system, like chamomile or things like that. It's an elimination diet in the short term to see which foods are irritating that individual person. And, depending on the person and what they've been eating before and what they already know they're sensitive to, and if they have any bladder issues or other pain, we design that elimination diet pretty individually. But there are some places you can start. Even if you just start with those 4 or 5 things, take the pressure off and focus even more than that on adding the nutrients. Do that really consistently for 1 month while you're also noticing, like, when am I really stressed out? How does my stress impact the pain and the irritation of my vulva? We often don't think that these things are at all related. We don't really think about our vulva being related to our stress level. But as we start to track it, and I like to have my clients walk around with a little tiny journal where they actually pay attention to not what irritates them, but what's making them feel better. So when people have chronic pain and chronic irritation conditions, every time you show up at, a doctor or a clinician, it's like, what's your pain level? How long have you been in pain? How chronic is your pain? And you're always thinking about and monitoring your own pain. And to me, that's not the best way from a pain science perspective to calm the brain into thinking about being in less pain. So instead of focusing on the pain, the little journal is about really focusing on when your pain is a little less. Who are the people you're around? What kind of a night's sleep did you have the night before? Did you have fresh salmon and vegetables for dinner and then you woke up and you had a little less pain? So starting to pay attention to when the pain is less helps to give us information about what is healing for you.
That is a really cool perspective. It's a very different way to assess and to monitor and experiment, so to speak. I also love that you're inviting the listeners who are struggling with this. And I recognize that this isn't everybody, but I would suspect that more women may have this issue than either realize or are willing to admit to it. My experience has been that there's an embarrassment around it. And I wanted to share these interviews because I think that there's not, from my understanding, there's really not a whole lot out there to help women with this condition. And I think it's important that you realize that it's tied to other things like the stress, the food that you eat, what's going on in your gut. Essentially, it's all one track. Yeah. More or less.
Right, it is. And I think the pelvic aspect of it is important too, because a lot of times, because the pelvis itself, this bowl is really pretty small. So if you have endometriosis or painful bladder syndrome or vulvodynia, any other kind of pelvic pain condition, you might have inflammation and, autoimmune kinds of pictures of lichen sclerosus, lichen planus around your vulva. And there can be some coexistence of these various different pelvic pain conditions. So sometimes you're not dealing with just one. And so we really have to take that holistic approach to unwind the whole picture.
That's really neat. I'm so glad that you were able to share about this because I don't know anybody else who can. and I love that you're such an expert in this area and that you do meld the physical therapy piece with the nutrition piece and looking deeper and trying to help people from a root cause perspective figure this out. It's really great. So, Jessica, where can everyone find you?
So the website is Integrative Women's Health Institute.com, and you can find me and everything else there.
I will make sure that in the show notes, there is Jessica's website and all of her social media. So it's super easy to find. And then you also have a hormone balance webinar that you're happy to share with everybody. So I'll put a link to that so that everyone can go and check that out if they feel that this is really an issue that they're struggling with and you'd love to get this put to bed so you can get on with life and not have to think about it anymore. But thank you so much for joining us. I really appreciate it.
Thank you so much for having me.
I'm so glad that we were able to have this conversation today because it means that we can add this to our growing resources for those struggling with lichen sclerosus. I've made sure to include all of the links and books that we've referenced today in the show notes. If you've got any questions that you'd love for Jessica to answer, head on over to this episode's post and leave those questions and comments there. In the meantime, don't forget to rate and review the Healthy Skin Show. And of course, make sure to share it with someone you know who could use a helping hand with their skin. Thank you guys so much for tuning in, and I look forward to seeing you in the next episode.